Get your magnifying glass out because we're putting two medical mutual policies under the lens. How's it going, everyone? I'm Joey Chingola with Chingola Insurance, and today we're going to take a really deep dive into Medical Mutual's HSA 3000 Silver and HSA 6000 Bronze. Now, they're exactly the same plan, except for the fact that the deductibles are different and they have a different metal color. Because when you change the deductibles, that changes the actuarial value of the plan, and which then doesn't allow it to be a silver or bronze or whatever. Don't worry about it. Just know that really they're going to operate exactly the same, and the only difference is the amount of money that you have to pay up front. So we're going to jump behind the computer right now and take a really deep dive into these plans. So let's do it. All right, so here we're going to use the Market HSA 3000 Silver benefit summary just as an example. But no, again, just like I mentioned earlier, the 6000 Bronze plan is the exact same thing, except where it says 3,000 for a single, 6,000 for a family, it's going to say 6,000 for a single and 12,000 for a family. So let's go ahead and just start right at the top. Deductible, as we had already mentioned, 3,000, 6,000. So if you are a single person by yourself purchasing this plan, you will have to pay the first $3,000. Once you meet that $3,000 deductible, then you will not have to pay any more money for covered in-network medical services. Now, of course, it is important to note in the non-network column right next to it that the single deductible jumps from $3,000 to $9,000 and the family deductible from $6,000 to $18,000. So obviously, always stay in network. And if we again jump one line down to maximum out of pocket, and because it is a 0% coinsurance plan, that is all you will have to pay. There is no 80-20 split, 90-10 split. It is your deductible, and then you are done. We'll talk about that coinsurance in just 1 second. But next, moving down from the maximum out of pocket, your accumulation method, you will see it says aggregated. That simply means that there is only one total family deductible. So if you have more than one person on the policy, you're all going to be going towards that family deductible. They aren't going to split it up as to two $3,000 deductibles like you might find on some plans. That would be called an embedded accumulation method. So instead of aggregate, it would say embedded. But this is an aggregate plan, so everything's going to be going towards only one deductible. And right now and after that is the coinsurance, which we already said is 0%. So once you hit those deductible limits, then everything is going to be paid for you, except obviously take note, it is 50% coinsurance on the non-network side. So again, always stay in network, and that's a pretty good reason, pretty good motivator, pretty good incentive to stay in network. And up next, it says dependent age, which is 28. So once you hit 28, then you will have to come off your parents' plan. So, and that will be, as you see, at the end of the month. You can stay on there. 26 is the federal law, but Ohio passed a law to extend it to 28. So you can stay on until you are 28 years old. And important, this is kind of something that gets glossed over or overlooked at some point, but the benefit period, meaning this plan, when it starts and when it ends, regardless of when you buy it, the deductible and everything is going to start and reset on a January 1st through December 31st cycle. So even if you bought this plan in the middle of the year, it doesn't matter. You just go ahead and your deductible will reset December 31st regardless of when you bought it, or you could have bought it in December and it's still going to reset. So it's something to definitely keep in mind, and is very important depending upon where you're at in that deductible cycle. So if you look at basically everything else on this page, you will see 0% after the deductible. The best part about HSAs is they really simplify things, and you only are going to pay towards your deductible. Once the deductible is met, then it is going to be taken care of for you. So there is no copays to keep track of. There is no coinsurance to keep track of. Just that one number, that 3,000 or 6,000 is the number you got to pay attention to. Once that's taken care of, then everything's going to be paid after. So for office visits for your primary doctor and for a specialty doctor or for an urgent care visit, you're going to pay the full discounted rate for that visit. So again, discounted rates, we've talked about them in other videos and other places on this website. But just really quickly, every insurance company is going to negotiate a rate that is a lot cheaper in most cases than what you would pay if you didn't have insurance. That's the discounted rate. That's your insurance kind of working behind the scenes in mysterious ways that you're not particularly always aware of. It's definitely a pretty impressive benefit if you do pay attention to what you would have originally been charged and what the insurance company was able to negotiate for you. Now, jumping down to preventative services, this is one of the only exceptions to the 0% after the deductible. Preventative services that are covered under the, as you see here, PPACA, that's the Patient Protection and Affordable Care Act, or otherwise known as Obamacare, is 100% or 0% to you, which basically means free. So if you're getting those preventative services done, you're not going to have to pay anything for them. Then if you go down the list here, preventative labs, x-rays, and medical tests that are not under the PPACA, you're going to have to, again, pay for the full discounted rate, and then it will be taken care of 100% after you hit your deductible. Again, preventative immunizations, preventative endoscopic services, all not included in the Obamacare plan. Again, all going to go towards your deductible and then 100% coverage after that. Now, you'll also notice a couple exceptions here as well. Pediatric vision is going to be the eye exam up to age 19. That is going to be just like the preventative services, where you're not going to have to pay anything for that. It's, again, mandated under the law that be included, basically free of charge. Pediatric vision hardware up to age 19. It will be covered. You will have to pay towards your deductible, and then after the deductible is met, you will go ahead and have that paid for, and that's only going to be one per benefit period. So one time between January 1st and December 31st will that be allowed to be covered. Routine physical exams and well-child office visits, again, will follow along that 0%, not including the deductible. So again, free of charge, basically, if you're having those procedures done, those services done at the right time. And we're going to move on to the outpatient services tab here, and you will notice that almost everything is 0% after the deductible. So allergy tests, cardiac rehabilitation, notice you're only going to get 36 visits per year, or per benefit period, I should say. Chiropractic services, you will get 12 per benefit period. Your diagnostic endoscopic services, so that's like a colonoscopy and things like that, where they're shoving tubes in places that you're probably not all that crazy about. And of course, your diagnostic lab, so that's your routine blood work, anything like that, anything that needs to be sampled, analyzed, or put under a microscope. Again, 100% after the deductible, or 0% to you after the deductible is met. And emergency use of the emergency room, emergency physician, and ancillary services, these are going to be both the same in-network and out-of-network, 0% after the deductible. One thing to keep in mind is this next line here where it says non-emergency use of the emergency room, and that is not covered, both in-network and out-of-network. So if you go to the emergency room for a sinus infection, it's not a good idea, because you're going to be paying for the whole thing, no discounted rate, no anything, not going to apply to deductible, and it's not going to be a fun experience for you. So you're going to want to make sure you schedule those non-essential, non-emergency visits to your primary care doctor, and make sure that you don't have to worry about it not getting covered. And basically everything else on this list, the occupational and physical therapy, you're going to get 40 visits per benefit period. The pulmonary therapy, 20 visits per benefit period, and speech therapy, 20 visits per benefit period, all going to be 0% after your deductible. And we should be pretty familiar with me saying that by now, as I am almost like 3 broken records at this point. And at the very bottom, not to be overlooked, probably one of the most important things on this benefit summary is surgery. So any surgery that is performed, again, 0% after the deductible. So it goes to show you basically all of this stuff that you could be concerned about. It is basically lumped in with lab work, surgery, office visits. All of it's going to go towards that $3,000 or that $6,000, or again, in the case of the bronze plan, the $6,000 or the $12,000 deductibles. Once those are met, then everything's taken care of, and that's 95% of what you're worried about anyways. So let's go ahead and move down to the second page of this thing. You notice here for the inpatient services, again, it's going to look very similar to almost everything else that we've already talked about. You've got maternity, and delivery. Now, that's new as of 2014. All plans have to include maternity as outlined by the Affordable Care Act. So before you had to add that extra if you thought you might need it, that's going to be included. That's just going to go towards your deductible. Then they're going to cover everything after the deductible's met. Same thing with mental health and substance abuse policies. Physical rehabilitation, you can go 60 days per benefit period. You're going to get semi-private room and board. Again, 100% after you meet that deductible. Skilled nursing facility, you're going to have 90 days per benefit period. So you can only be in a skilled nursing facility for 90 days per benefit period, January 1st through December 31st. And again, inpatient services as well. So again, we were talking outpatient surgery. So that was the kind of the more quick and dirty surgeries that, a knee scope, something like that. Where inpatient services, inpatient surgery, meaning you're admitted surgery, a couple days to recover. Again, this is going to show up here as well. Very important. One of the big ones that you obviously want to make sure is included. Again, it's included. And finally, we're going to wrap up with the additional services and prescription drugs. For the additional services, we have ambulance ride, durable medical equipment, home health services, 100 visits per benefit period. So again, only 100 visits between January 1st to December 31st. Hospice, diagnostic imaging. So again, if you need a scan, now this is where, again, organ transplants, but other than that, it's 100% after the deductible. Private duty nursing, again, that's going to have a limit of 90 days per benefit period. And then finally, your prescription drug, this is important, in-network only, so there is no out-of-network coverage for your prescription medications. Again, you're going to pay the full discounted rate for those medications. And then once you have met your deductible, you will not pay any more for any medications as well. So again, doctor's visits, medication, hospital stays, surgery, all of that stuff, all going towards that $3,000, that $6,000, whatever that number is in the deductible, all of that stuff is going towards that. Once you've met it, then Medical Mutual is going to take the rest of the bills for that benefit period. All right, so there you have it. That was a complete detailed breakdown of Medical Mutual's HSA 3000 silver and HSA 6000 bronze. And hopefully you have a better understanding how these plans work. Obviously, they're pretty straightforward. There's not a whole lot of moving parts to them, so you shouldn't have that hard of a time remembering what's what. However, you probably are considering, now that are kind of knee deep in this health insurance journey, you probably want to know how these plans stack up to others that we've talked about here and others that you may have been considering. And so what I want you to do right now, click on my face, and that's going to take you to the next step, if you will. We're going to kind of actually look at where we go from here. Now that we've identified a few plans that we think might work, well, let's stack them side by side, see what's what, and then learn how to make a good decision and go from there. But of course, I do appreciate you taking the time to watch this video. I am Joey Giangola with Giangola Insurance. Take it easy, everybody.